Okay. Okay, welcome everyone. I am Dr. Gia Merlot, Chair of the Lifestyle Psychiatry Caucus for the American Psychiatric Association. Thank you for coming to our monthly webinar. As many people have already told me that they weren't able to attend today, but this will be recorded and it will be available in our Learning Resource Center of the American Psychiatric Association. It's available for 1 CME. If you attend today, unfortunately, you have to watch it there, or you can use this code that I will be giving you. I will be putting in our chat. I'm sorry, in our website at the end of this. I will put it there that you can actually put it to get the 1 CME. Today we have 4 stars within the lifestyle medicine world, and I'm very excited to be able to share this information with you through them. I'm going to introduce them briefly because they have a lot to say and I don't want to take up too much time. But Dr. Melissa Sundermann is a double board certified physician in internal medicine and lifestyle medicine with over 25 years of experience in medical practice. She's widely recognized as Dr. Outdoors, and she's a leading expert in nature as medicine. She's a lifelong outdoor enthusiast, and Dr. Sundermann finds inspiration in healing and running, biking, hiking, skiing, and immersing herself in nature. She's a 12-time Boston Marathon finisher, a 3-time full Ironman triathlon finisher, and is currently training for upcoming ultra marathons. Dr. Andrew McHugh is a board-certified family, preventive, and lifestyle medicine physician. He is faculty at Loma Linda University School of Medicine, where he serves as the medical director of the Center for Health Promotion, Preventive Medicine, and Population Health, clerkship director and director for lifestyle medicine residency training curriculum, and serves as a physician representative on the board of directors for the Medical Fitness Association. Dr. McHugh is also a professional middleweight strongman and holding the title of California's strongest man 4 times, and owns his own strongman and powerlifting gym in Redlands, California, where he has coached state, national, and world champion athletes. Dr. John McHugh is a graduate of Columbia College and Harvard Medical School. In 1995, he followed his childhood dream to move to California and trained in OBGYN at the University of California in San Francisco. Dr. McHugh has been the faculty of UCSD, UCI, and USC's medical schools and served as department chair at Scripps Mercy Hospital in San Diego. He also serves as the chair of the American College of OBGYN District 9, California and Ecuador, representing over 6,000 physicians. And last but never least is Dr. Melissa Bernstein. She's the associate professor and chair of the Department of Nutrition at Rosalind Franklin University of Medicine and Science. She's an internationally recognized speaker and educator, and one of this year's Today's Dietitians Top 10 Dietitians Making a Difference. She's passionate about educating students and healthcare professionals on the importance of food as medicine for improving health outcomes and quality of life. She has co-authored 6 nutrition textbooks and has contributed, authored, and reviewed textbook chapters in peer-reviewed journal publications. So without any further ado, I am going to share my slides and we are going to get started with this. Unfortunately, I do have to end exactly at 8 o'clock because I have another meeting to attend. But if you want to continue, we can maybe continue this for a few minutes. Is everyone able to see my screen? Yes or no?
Yes.
Yes. Okay,
Yes.
good. Okay, great.
All right, so GM, I'm the first one to speak. So how about if I start and I'll just say next slide for you to advance?
Yes. Just next. Just say next.
Next. Okay. All right. Well,
Yes.
welcome everyone. So the title of our talk this evening is The Protein Prescription, Powering Longevity with Science. And here are the disclosures that you can read through. And our objectives. At the end of this session, participants will be able to define a healthy plant-based diet, explain the benefits of a healthy plant-based diet, determine protein needs of healthy individuals, discuss circumstances that may increase protein needs, and list healthy plant-based protein sources that will be appropriate for specific populations. Next slide. So I just wanted to know how many citations typically come out on the topic of nutrition. And so I looked up with my friend ChatGPT and said, how much approximately on PubMed on nutrition? And we get about 50 to 100,000 citations every year on the topic of nutrition. So it is very, very confusing. It's confusing for ourselves. It's confusing for our patients. And so we're going to talk to you today about the pillar of nutrition. Within lifestyle medicine, we have 6 pillars, and food as medicine is definitely one of them. In addition to exercise as medicine, sleep as medicine, stress management, social connection, avoiding risky substances, but definitely food is medicine. So with all of that confusion, some of the simplest quotes, can you go back, Gia, one slide, please? One of the simple quotes that I love is from Dr. Michael Greger, who's also a lifestyle medicine physician. And he says, a healthful diet is nothing bad added and nothing good taken away. And I'm also a big fan, next slide, please, of Michael Pollan. And he says, eat food, not too much, mostly plants. And that is what we adhere to as lifestyle medicine physicians. In fact, Hippocrates, the father of medicine, will say that he was a lifestyle medicine physician also, because he said, let food be thy medicine and medicine be thy food. So we do advocate for a plant-forward dietary pattern within the American College of Lifestyle Medicine. And what is the definition of a whole food plant-based diet? Well, it is a dietary pattern centered on minimally processed vegetables, fruits, whole grains, and legumes, with nuts and seeds in moderation. It minimizes or excludes meat, including poultry and fish, dairy, eggs, added sugar, and processed oils. It is an evidence-based dietary pattern centered on whole plant foods eaten as close to their natural state as possible for disease prevention, treatment, and yes, even reversal. Next slide. So what does this look like? This is the plate that is one of our resources for the American College of Lifestyle Medicine. This is what a healthful whole food plant predominant plate looks like. So on the left-hand side, you have Eat the Rainbow. You have lots of fruits and vegetables, just very colorful, full of phytonutrients, covering half the plate. About a quarter of the plate are going to be whole grains. So those are going to be like quinoa and brown rice and bulgur. And then also plant proteins. And yes, we will be talking about how you can get healthful protein and enough protein through a plant-based diet. So on the screen, we'll see beans, we'll see tempeh, we'll see tofu, edamame, legumes, lentils. Next slide. So why do we advocate so strongly for food as medicine within lifestyle medicine? Well, the health benefits of a plant-forward dietary pattern are immense. We tend to see lower body mass indexes, lower body fat, lower overall mortality, lower mortality from ischemic heart disease, reduced medication requirements. It is not uncommon as a lifestyle medicine physician that I am de-prescribing, I'm lowering doses of prescriptions rather than adding to their medication list. It helps to maintain sustainable weight management, reduced incidence of high blood pressure, high cholesterol, and even diabetes, reduced risk of certain cancers, especially colorectal cancer, reduced obesity, inflammatory markers, reversal of advanced coronary artery disease, and reversal of type 2 diabetes. So a plant-based diet supports living longer, not just living longer. So really getting into that extending health span and well span, not just lifespan. Next slide, please. So when we're looking at whole foods, whole plant foods, why are these packages so beneficial? Well, they're rich in complex carbohydrates that provide fuel, but they also contain fiber, vitamins, and minerals. Plants, including fruits, vegetables, beans, whole grains, nuts, and seeds, all contain fiber. And remember that animal products, eggs, chicken, fish, steak, no fiber. And plants are naturally lower in fat, and that fat that they do contain are the healthy fats. So mono and polyunsaturated fats, which have omega-3s and omega-6s, which is good for our brain. It minimizes or eliminates trans fats, saturated fats, and cholesterol. And we know that those are detrimental to our overall health. Plants also, and we'll get into this further detail, ideal levels and type of protein. Yes, you can get protein through plants. Plants are also micronutrient rich. They're rich in vitamins and minerals, and they have antioxidants. And they also have phytonutrients. So phyto meaning plant and nutrients. So we talk about eating the rainbow. And they tend to be lower in caloric density, right? You can have nutrient density and caloric density. Plants are very nutrient dense, but they are low in caloric density. Next slide, please. So we're here speaking for the American Psychiatric Association. So of course, this audience is largely going to be concerned and want to know about brain health and nutrition. How does this help our brains? Next slide, please. So we know that food and mood are connected. And we know that the brain and the gut are connected through the gut-brain axis. And we talk about the gut microbiome, 38 trillion organisms living in the gut microbiome. So bacteria, viruses, fungi, archaea. And it's really important to nurture those 38 trillion organisms because 95% of our serotonin is actually produced in our gut. And this audience is very familiar with serotonin. 50% of our dopamine is produced in our gut. And this is where 70% of our immune system resides, in our gut microbiome. And so the health of the gut microbiome can really influence our brain function and behavior. We talked about plants having more fiber, plants having fiber, animal products have no fiber. And that fiber is very important for the gut microbiome because that serves as the prebiotic. That is like the food that nurtures all of these organisms in our gut microbiome. And the more fiber that we consume and the more diversity of plants, we actually optimize and increase the microbial diversity. And when we have diversity in our gut microbiome, we are producing more short-chain fatty acids. And short-chain fatty acids, acetate, butyrate, propionate, act as messengers going all over our body, including our brains, to help optimize our health and well-being. Next slide, please. Plants are also anti-inflammatory. And I just mentioned that 70% of our immune system resides in our gut microbiome. So immune system, yes, fighting off infection, but also decreasing inflammation. Inflammation that could manifest as an achy joint, but also chronic inflammation that manifests as insulin resistance, obesity, dementia, chronic kidney disease, autoimmune diseases. So the more that we nurture our gut microbiome, we are going to reduce inflammation. And also chronic inflammation can contribute to depression, anxiety, and cognitive decline. So plants are shown to reduce systemic inflammation. And when we check systemic markers, when I check blood work on my patients, I check C-reactive protein or interleukin 6, or I don't normally check for tumor necrosis factor alpha, but these markers tend to decrease and decline the more plant forward we go. And plants are also rich in antioxidants, vitamin C, E, polyphenols, phytochemicals, and fiber. Next. Also, when we consume more plants, we tend to stabilize our blood sugar. High glycemic, highly processed dietary patterns, we have these sugar crashes, we have these peaks, we have these troughs. When we have this big glycemic load, we dump out insulin, and that leads to insulin resistance. It leads to spikes and steep falls of our glucose, which can contribute to mood swings. So by consuming more whole foods in their whole food form, we have steadier glucose, we have more balanced energy. And this can help to prevent insulin resistance, which insulin resistance is oftentimes the precursor to developing type 2 diabetes down the road. Next. So some key nutrients that are found in plants that are really good for mental health. First of all, folate, very important for neural tube formation. And folate can be found naturally in leafy greens and in beans, and this helps support serotonin and dopamine synthesis as well. Also, magnesium, found naturally in nuts, seeds, and whole grains, can act as a parasympathetic or relaxation. It can help calm that nervous system. And then, of course, omega-3 fatty acids, which are found in flaxseed, chia seeds, and walnuts. These can be brain protective. And so make sure that, I always tell my patients that if you do have those seeds, flax seeds, you want to ground them. They want to be in the ground form for flax seeds, and then sprinkle them on everything. And then also polyphenols, which are found in berries and in herbs, are antioxidant and anti-inflammatory. Next. Oops. And when we talk about mental health and chronic disease, we need to remember that it's oftentimes a two-way street. And remembering that depression is or can be 2 to 3 times more common in people with chronic disease. So I think that if we can lower the risk of chronic disease, improve, reverse chronic diseases, hopefully we can then address and help to address mental health as well. So looking at whole food plant-based diets, they help to significantly reduce the risk of cardiovascular disease by lowering LDL levels, blood pressure, inflammation, can lower the risk of type 2 diabetes and improve insulin sensitivity, can lower the risk of obesity. Remember, plants have lower caloric density, but higher satiety with all that fiber and healthy fats, and can also lower the risk of certain cancers with all that fiber and phytochemical protection. So essentially, treating the body helps treat the mind. So what is the evidence for plant-based eating and mental health? I just am sharing just a few trials. First of all, we have the SMILES trial. And what they found in this intervention, this 12-week intervention of individuals who had been already diagnosed with moderate to severe depression, they were randomized into 2 separate arms. One was providing nutrition support and going with more of a Mediterranean style dietary pattern. And the other group was getting support, but no dietary intervention, just group support. And what they found after this intervention was there was a significant decrease in depressive symptoms in the arm that went with more of the Mediterranean plant-forward dietary pattern. Another study is the HELENA study, which stands for the Healthy Lifestyle in Europe by Nutrition in Adolescents. And what they found were in kids, in adolescents that consumed more plants, they actually had lower stress indicators, they had higher resilience. So all of these kids, that today that are snacking on highly processed foods, fast foods, if we can just get them to eat more plants, it could help their mental health. And then, of course, the Adventist health studies. Dr. Andrew McHugh, who works in Loma Linda, this is where a lot of these studies were conducted. What they found were that plant-based individuals reported better mood and vitality. So what we're seeing is that lower intake of processed foods can cause less neuroinflammation. Next slide. So some take-home points as psychiatrists or working in the mental health field or whatever field you work in if you are seeing clients and patients. I ask you and invite you to ask about dietary patterns during your evaluations. And if you need help, look for a lifestyle medicine trained clinician and an integrative care team. And start small. We always want to meet patients where they're at, right? So start small by maybe just adding 1 plant-based meal per day. And just maybe incorporating more dark leafy greens, more berries, or more legumes and beans. And try to share resources. And if you guys need resources, this team here, we can share resources as far as apps, podcasts, books, support groups, and cookbooks that can really help yourself to get educated and also for your patients. So some key takeaways from my section today, the healing power of a plant-based diet, is that a healthy plant-based diet supports mental health through gut-brain communication, blood sugar balance, and anti-inflammatory effects. And nutrient-dense plant foods are rich in mood-supportive compounds like folate, magnesium, and polyphenols. Plant-based eating patterns tend to lower risk of chronic diseases such as cardiovascular disease, diabetes, obesity, which often co-occur with mental illness. So nutrition is a powerful, underutilized tool, or it can be, and food is foundational. Remember, food is medicine. And remember that 1% better is what I tell my patients all the time. Small, sustainable dietary shifts can lead to significant improvements in emotional and physical well-being. So thank you. And I'm going to turn the microphone over to one of my colleagues, Dr. Andrew McHugh.
Thank you, Melissa. So it wouldn't be a psychiatry session without addressing a little bit of cognitive bias. So when someone walks into the door and says, man, where's the protein for this meal that you're serving? What did your brain think of? If you're a normal American, it's probably meat. So we're just going to do a little bit of cognitive reconditioning real quick. When I say protein, just go ahead and say out loud plants and animals. protein, plants and animals, protein,
Plants.
animals,
Plants.
plants and animals. All right, so now that we're conditioned, next, let's see if our video plays. And if it doesn't play, that is okay. But oh yeah, this will be good. It'll be worthwhile to have a little bit of comedic relief with an older Taco Bell commercial that's quite funny.
Hey, I got you guys a protein shake.
Awesome. I love protein.
I know you love protein. I love protein too.
Yeah, protein rocks. So you guys talk about protein? I love protein. I love protein too.
We know you love protein. Protein rocks.
Awesome. Protein rocks.
Protein.
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 Should we tell them about these?
Absolutely not.
Now there's a tastier way to get some protein with tender grilled chicken, corn salsa, and guacamole. Taco Bell's new Power Protein menu is packed with flavor.
Somebody. Hey,
So you probably can't go anywhere without being bombarded by some sort of protein snack, or your social media feed be someone talking about, oh, you have to get your protein in. So we're going to bro it up a little bit and talk about our protein. Interesting fact, the star of that video, Cali Muscle, is now plant-based. He switched over to a plant-based dietary pattern. And then we'll start, Gia, with the slide that says protein recommendations.
I have to get back. Give me one second.
Sorry, I ruined all of our sharing with the video.
Yeah, there we go. Are you good?
Yes.
Okay.
And so when we're looking at the protein recommendations, so if you turn the label around and look on the back and get that recommended dietary intake for that protein, this number is actually developed based off what is needed to preserve nitrogen balance in the body. So to just maintain. But the reality is, when we were determining this number with the data, we weren't taking into account some very important factors. So just think about this recommended daily allowance or recommended daily intake as more of the floor and not really the goal, because we're not wanting to just maintain, especially as we have processes that make it harder to hold on to that muscle mass. Next. So what does the data actually show? When we're talking about muscle performance and preserving muscle mass, it then gets framed into the context of active individuals. But this is lifestyle psychiatry. So I'm pretty sure we want all of our patients to be active. So my cognitive bias is that these are recommendations for everyone because everyone should be active. And so this is the data summary from multiple meta-analyses across multiple populations. And you see that there's this massive range, somewhere between 1.2 grams of protein per kilogram of body weight per day, all the way up to 3.1 grams of protein per kilogram of body weight per day. And if you just wanted me to arbitrarily throw you out a number that I would recommend, it's somewhere around 1.6 grams of protein per kilogram of body weight per day. Now, you do want to adjust this for someone who has a very high BMI that is due to excess adiposity. And so a simple way that you can adjust that is to use adjusted ideal body weight or lean body weight for that calculation. Next. And so I gave you a massive range. How do you even begin to decide within that range? I would say definitely nutrition should take into account cultural preferences and dietary preferences. So that's one piece of it. But there are also people who need a higher dose to get the response that we're looking for. And in this case, the response is muscle protein synthesis. So if someone is older, is at a large calorie deficit, they're sedentary, they have chronic health conditions that lead to dysregulated inflammation and make the body more resistant to building those muscle proteins, they will need a higher signal from the protein itself in order to drive that muscle building. And we've even gone to crazy amounts on this high signal. When I say that, I mean it makes me feel nauseous thinking about eating 3.5 to 4.4 grams of protein per kilogram of body weight per day. But that has been shown to be safe for individuals with normal renal function. Next. And so back to our cognitive reconditioning, plants and animals. Because when we're using that 1.5, 1.6 reference number, it doesn't matter if it's coming from a plant or an animal. Yes, certain animal proteins are more bioavailable, but if you're eating a variety in your diet that has a mix of those amino acids, you're getting an adequate signal when you're in that 1.5, 1.6 grams of protein per kilogram of body weight range. So how can you help get the adequate leucine, which is the amino acid in that protein that we're looking for to drive that signal? Combine foods, which is what we do every single day on our plate. So if your plate looks like what Melissa showed you before, where you have those vegetables, fruits, nuts and seeds, whole grains, legumes like beans, peas, lentils, and then if you're adding in the animal protein in there, you've complemented, right? So it's the food matrix all coming together. But I will throw out my very hot take just to drive some controversy with the conversation. I think most individuals will benefit from some sort of protein supplement. Not that I think that they need the extra protein, but it is a very powerful convenience tool. If there is a single American out there that has the time to cook, sit down, eat, wash their dishes for every single meal that they eat every day, I am very jealous of that individual. So you will see I have multiple protein supplements in my nutrition, but it's really just that convenience tool to help me adhere to my overall dietary pattern. Next. So you get to see exactly what that looks like. So in last year's California Strongest Man, I was competing in my normal weight class, which is about 40 pounds heavier than I am currently. And nobody got big without eating. So it takes a lot of calories to gain weight, regardless of if that's for excess adiposity or, in this case, excess muscle mass. No such thing. But you can see what my nutrition looks like. A metric ton of carbs, there is protein and there is fat in there. And it's prioritizing those whole foods. But you'll also see that I intentionally process some of those foods by blending them up just so I can drink some of those calories down. And that's where I'm adding in that extra scoop of protein as both a way to boost the protein in the meals, but also to boost the calories in a way that I can quickly get them down, because your stomach can only take so much. When it stretches, it's going to get full and you're not going to be able to eat as much. But that's going to shift with the next slide. And so here you see the beauty of actually eating more whole foods. My calories come down immensely, even though my volume of food actually goes up. The actual weight of the food is higher. So just prioritizing more of those whole foods, I'm actually eating more, but it is less calories. And you'll still see that with both of these, the protein recommendations are higher than that 1.6 that I was talking to you about. I will tell you that most athletes do tend to fall on the higher side of things. I think that's part of it is culture more than anything. The other part of it is we just want to make sure that we're getting every last benefit that we can, because we're fighting for that 1 to 0.5% of performance to beat out our competitors. But you can see I'm a creature of habit, and so this would be probably 95% of my meals throughout the week would follow this pattern. So next slide. How do those compare? One was more calories. I had to process them to get them down. I did have higher protein in the other in the higher calorie, but my training load was also higher at that time as well. And it also just happened to play out that way. I didn't just think too much about it. I just eat consistently. And as long as my weight is going in the correct direction, my performance is going in the correct direction, I don't stress about it too much, because of the truth of the matter is most of us are already getting adequate dietary protein in our diets. For maintaining that nitrogen balance, there might need to be a conversation about performance, and maybe it's just a tad bit more. Next slide. But if you wanted that one single concept that I feel like is the unifying theory for dietary patterns, I would say calorie density, because it doesn't matter if you're wanting to lose weight. It doesn't matter if you want to gain weight, right? Taking into account that calorie density concept and the relationship that food that goes into the stomach and stretches it and creates that fullness signal plays a role in how many calories you take in. So if you wanted to eat something that's on the right side of that graph over there in the red, could you just pair it with something that's on the very left side of the graph in the green, and then find that balance so you can both enjoy food and then get the health protecting effects. Next. If you want to read more about the science around nutrition and athletics, this is actually one of my favorite resources, the Switch for Good campaign, Let the Plant Games Begin. It's incredibly well referenced. It is framed into the context of plant-based athletes. You can see a lot of famous ones there. You'll see that most of them are eating above that 1.6 grams of protein per kilogram of body weight, but I think that, again, just culture, dietary preferences driving that one. But this was a great resource for me because it really brought into that athletic information into the plant-based world, which I feel like was a huge gap that we had previously. And with that, I will turn things over to John McHugh to talk about protein in pregnancy.
Thank you so much, Andrew. Really appreciate that. And I'm so glad we get the chance to do this. I'm going to try to get through these slides, and we might not get into all the details because I really want to save some time for my colleague, Melissa Bernstein, who has a fantastic presentation at the end. I'm an OBGYN. I'm really going to focus on some of the issues that happen at specific points in a woman's life cycle: preconception, pregnancy, lactation, and also talk a little bit about perimenopause. Talk a little bit about some of the risks I see if you focus too much on animal-based proteins, and then also talk about plant-based sources, because there are significant benefits, I think, but there are also some real concerns patients have, and talk about how we address them. Next slide. Protein in preconception health, the general recommendation, I'm going to stick more to the RDA, which is going to be 0.8 grams per kilogram per day, which is about 60 grams, which is maybe in a plant world, 3 cans of beans a day or 2 pounds of tofu a day. And that's a lot to eat for patients. So I do see the benefit for some patients of doing something to supplement, just even to get these recommendations. There are some recommendations that if a woman's preparing for pregnancy, to start to increase that up by about 25% to 1 gram per day. And that would be a pretty substantial amount of protein to consume, more like 80 grams per day per woman. But we do see this study, it's really interesting. The #1 cause of infertility is ovulatory dysfunction. And just shifting a little bit of that protein from animal protein to plant-based protein with more antioxidants and fiber does significantly decrease the risk of ovulatory dysfunction. Next. How about men? We see some benefit for men as well by getting adequate amounts of protein for their sperm health. And we do have some recommendations about increasing that for men, but it's not clear. It's not as clear that men should shift from animal-based to plant-based, but there are some data. One of the significant causes of infertility is sperm morphology, abnormally shaped sperm. And we do think that when men shift to more plant-based proteins with more antioxidants, they do get to better sperm morphology. Next slide. In pregnancy, there's a consistent recommendation to increase that protein up to 1.1, going all the way up to 1.3 kilograms per day with lactation. So we're getting to about a 70% increase from the baseline that we recommend. As Andrew mentioned, normally we use current body weight, but if you do have somebody with substantial obesity or somebody who's substantially anorectic, probably what I would do in those cases is talk to a nutritionist and see if it should be adjusted, because in some cases, ideal body weight is more commonly used. Next. I wonder a little bit if protein is the nutrient we should really be talking about. We really don't see substantial deficiencies in pregnancy. Only 2% of American women are deficient in the first trimester. And even when we get to those increasing amounts in the second and third trimester, we're only at about 9%. Most American women already exceed these recommendations for protein intake, but 60% of Americans are trying to get more. I'm not saying it's something we shouldn't talk about, but on the next slide, if you can go to the next one, I want to talk about a couple things that we really should be talking about. 95% of patients, my patients and your patients, are not getting enough fiber. So we do see that as a really substantial deficit in the diet. And by getting more animal-based protein, you're not addressing that at all. If you are getting protein from whole foods, beans, greens, you can get much more of that fiber that's needed. Iron deficiency globally is one of the greatest problems we see in pregnancy. And even in America, where we have such great diets, a third of women are still iron deficient. And folate is one of the greatest deficiencies we see, causing neural tube defects. Even with the fortification that we're using in foods today, still 1 in 5 women have insufficient folate, and animal-based sources are not getting at that. So where I'm seeing is a win-win is shifting our patients to get their protein from whole plant-based foods, beans and greens predominantly. Next slide. What are the risks? This is a study some of you probably know, the Dutch famine study. It wasn't really any randomized controlled trial. It was observational data during World War II with women in concentration camps in the Netherlands who were severely protein deprived. What we saw in those studies is the fetus predominantly gets the nutrients. The woman is not getting as much. And so we saw severely emaciated women, but the fetuses in general did well. One of the most interesting things with that study is that later in life, those children grew up and had more health problems. So we think that they had epigenetic alteration during that famine, and we do see future cardiovascular and endocrine risk in those patients. Next slide. What about lactation? This is an interesting slide. I don't know if you can see the small print here on the screen, comparing human milk to cow's milk. Cow's milk, if you recall, has the requirement that it's going to turn a baby calf into a humongous cow. That's not what humans need to do. Human breast milk is definitely better for the fetus. As you can see, human breast milk has a lower protein concentration. It's not building the muscles of a cow, but it has a much higher carbohydrate concentration. Inadequate protein in lactation can cause significant issues both for the mother and the fetus. Usually what we see is problems getting back to their normal health, healing after a cesarean section, for instance, and getting back the blood that they lost. Next. In the perimenopausal period, we definitely see increased protein needs. Why is that? Because when that estrogen is lost, patients have a harder time building muscle. And we know that building that muscle as they get into aging, which Melissa Bernstein will talk about, is really critical. So let's try to optimize it in the perimenopausal period. We also know that protein is important for immune health. Immunoglobulins are made out of protein. So women that don't get enough protein in perimenopause do have greater health risks. We do think that there is an impact on mood disorders because protein, amino acids are used as neurotransmitters, and also hot flashes. We see more hot flashes in women who are protein deprived. Next slide. Meat and reproductive health. What are the risks of meat? We know that meat is associated with gestational diabetes, one of the most common conditions I see in pregnancy. And we know that processed meat is even worse. It's associated with oxidative stress and preterm labor. Hopefully none of you went to a barbecue last week, and I'm sorry to tell you this, but when you cook meat at high temperatures, especially with any sugary sauces, you're creating these advanced glycation end products, which are one of the predominant drivers of polycystic ovarian syndrome. And that's the #1 cause of female infertility that we see. Next. What about fish? I myself consider myself a pescatarian, but unfortunately this study was done in the University of Hawaii, where they looked at patients who ate fish, and they found microplastics embedded in the placentas and in the fetuses of essentially all of their patients. We think that microplastics are more commonly associated when you eat the whole fish. That would be something like an oyster or a sardine, but they're definitely out there in the fish that we see. The other big substantial risk is mercury, especially when you're eating high-level predator fish, such as tuna or swordfish. And we think that that's clearly associated with low IQ in the fetus when it develops. So fish has its risks as well. What about dairy? Next slide. This is a great book written by Neil Barnard, who I think did one of these talks here, called The Cheese Trap. Cardiovascular conditions are the #1 cause of mortality in pregnancy, the #1 cause of mortality in the perimenopause, and cheese is the #1 source of sodium and saturated fat, which is associated with those risks. Dairy is clearly associated with fetal macrosomia, the fetus growing too big, just like a baby cow would. And there has been a lot of concern about dairy and breast cancer risk. I don't see a clear trend in that data, but we think that could be found in the future. Next slide. What are the additional benefits? Here's a great comparison, 100 grams of beef, 100 grams of beans. They have roughly the same amount of protein, but the beans have fiber, calcium, magnesium, really substantial benefits. We know that soy products decrease hot flashes, and this is part of the reason why Asian cultures have a much lower risk of hot flashes. And plant proteins have much more calcium, which we know is essential, not in a supplement, but in a whole plant-based food. Next slide. So what about fiber? 95% of Americans are deficient. And if we can get that in those plant-based proteins, we're decreasing the risk of preeclampsia, we're decreasing the risk of breast cancer, and improving fetal outcomes later. So I like to say fiber needs to be the new protein. Next. So the concerns that our patients come in, am I going to get enough protein? A well-planned plant-based diet will have enough protein, but it has to be planned. It has to be thoughtful. Will I get the right amino acids? As long as patients are eating a variety of plant-based foods, they will get enough of the right amino acids. Problems show up when they only eat one food. Next slide. What about B12? Patients who are vegan have to supplement with B12. There's not enough in prenatal vitamins, and that's been clear across the board. I won't get into the details on that. I have that in my slides here. You're welcome to take a look at the deck later, but it is really important that our patients do supplement with B12 if they are vegan during pregnancy. Next slide. Can I get enough iron? Absolutely, you can get enough. What I always do is recommend patients take it with vitamin C, either a glass of orange juice or throw some citrus in their salad. And they can get enough, but we see patients need additional iron supplementation, even if they're eating lots of red meat. Some patients simply need more iron during pregnancy. And that's it for me, and I'll turn it over to Melissa.
Thanks, John. Hi, everybody. So now we're going to really switch gears and talk about the protein needs and recommendations for older adults. Next slide. And this is important for us to discuss because older U.S. population is growing older than it's ever been. And by 2050, we expect it to be about 23% of the population, with those 80 and older as the fastest growing group. Next. And aging brings about some physiologic changes that affect protein requirements. We see a progressive decline in basal metabolic rate by about 1 to 2% per decade. And this is primarily due to lower levels of physical activity, which contributes to a lower caloric requirement and a progressive loss of lean mass and an increase in fat mass. And this is directly relevant to our discussion about protein because about half of all the protein in the body is found in muscle, and this lean mass declines with age. And there are also some changes in protein metabolism that occur with age. Older adults exhibit anabolic resistance, and we heard about muscle protein synthesis from Andrew. Older adults have reduced muscle protein synthesis, and this means that their muscles don't respond as robustly to protein intake and this anabolic stimulus. So they also might have increased protein turnover, and this could be coming from inflammation or illness. Next slide. So to illustrate, to really take a good visual of what this looks like in terms of these changes in body composition, this is a slide from my graduate work at Tufts, and you see a cross-section of the thigh from a younger woman as compared to an older woman of the same body weight. And the slide on the left, the image on the left, is the older woman, and you see a significant amount of increase in the subcutaneous fat as well as the intramuscular fat, and a decrease in the overall muscle protein amount and quality. So the goal with aging is to maintain quality of life, independence, and health. I recently read a quote that says aging is not a diagnosis, but it's actually a process that we can influence. So when we look at influencing and preserving muscle mass and strength and function, and the prevention of sarcopenia, sarcopenic obesity, frailty, functional declines, these are things that are commonly accepted to be normal consequences of aging, but we know that these conditions can be improved with lifestyle interventions, including nutrition and exercise. Next slide. This next slide illustrates in very simple terms this vicious cycle of a poor diet and disease burden and loss of functional independence that commonly occurs in older adults, where poor diet can lead to inadequate energy and nutrient intake, which has both physical and metabolic consequences that can further impact their physical health and functional status and their ability to consume a high quality diet. Next slide. And this is important because when we look at the dietary reference intakes for older adults for protein, we see that it's similar to younger adults. The acceptable macronutrient distribution range, the AMDR, is 10 to 35% of total calories. And the RDA also stays the same at 0.8 grams of protein per day. Next slide. And there's a concern, however, that these RDAs actually fail to adequately consider those changes in muscle protein metabolism and physiology that we see occurring with aging, this anabolic resistance and increased protein turnover, and that the recommendations don't consider physiologic endpoints such as measures of muscle strength and function, and these are relevant to healthy aging. Next slide. And that's because there's a number of factors that influence the protein requirements in older adults, such as the metabolic demands and medical conditions, the type and amount of physical activity, as well as protein and amino acid metabolism, which is affected by the overall quality of the diet, the distribution, the total caloric intake, as well as the adequacy of protein, amino acids, and other nutrients. Next slide. So there's also a number of potential benefits for higher protein intake in older adults: improved muscle strength and function, prevention of sarcopenia and frailty, maintaining energy balance and weight, bone density and preventing falls, improved wound healing and immune function, as well as the prevention in onset of chronic diseases, promotion of recovery from illness, low mortality, improved quality of life, as well as longevity. So next slide. So what is the actual amount of protein? Well, that really is a range, and it depends on, like we said, the level of type of physical activity, as well as medical status and condition. And as we heard about from Andrew, even though the RDA remains at 0.8 grams per kilogram per day, there are many expert groups that suggest that really higher amounts is necessary in older adults. And this amount could be closer to 1.2 to even 1.5 or more grams per kilogram per day. And in those that have an acute illness, or maybe possibly in like a rehab setting, could be up to 2 grams per day, which could be appropriate. And this is at that higher end of that acceptable macronutrient distribution range. Experts also recommend a balanced distribution of the amount of adequate amounts of protein, with a favorable amount for protein anabolism being in that range of about 25 to 30 grams of protein per meal, including, and this would be including protein at each meal. And protein quality is another key determinant of the potential dietary protein to promote and sustain skeletal muscle anabolism. Next slide. So for an older adult weighing about 140 pounds, eating about 1,600 calories a day, the RDA at 0.8 grams per kilogram per day would be about 51 grams a day, where we would be looking at something like 76 grams per day at 1.2 grams per kilogram per day. And that acceptable macronutrient distribution range, we will be looking at that higher end of the range. So somewhere in that 120 to 140 grams per day. Next slide. However, average intakes of protein for older adults are within the recommended range for males, but we see from this slide here that they're below the recommended intake for females. Next slide. When we look at this, though, from the perspective of food groups, most older adults are meeting or exceeding their weekly recommendation for meat and for poultry and for eggs, and these are a common source of protein for older adults. However, seafood, as well as plant sources of protein, whole grains, beans, legumes, peas, lentils, these are underconsumed. But these provide important nutrients that support a healthy dietary pattern. So many older adults can actually improve their overall dietary pattern and better meet their better meet their protein needs by choosing a wide variety of plant protein sources. Again, the beans, legumes, nuts, and whole grains. Next slide. So therefore, when we're considering ways to recommend increased sources of protein, one area to focus on with older adults to boost protein and improve the overall quality of the diet is to encourage a higher consumption of a variety of plant-based protein-rich foods. And it's likely that most older adults are also going to have a health condition that would benefit from a plant-forward diet. Heart disease, diabetes, obesity, dementia, inflammatory conditions such as arthritis, or GI conditions, the most common condition being constipation. So therefore, by adding more minimally processed plant-based sources of protein, it actually goes just beyond protein and muscle and can provide many nutrients that older adults could be lower in: the fiber, the antioxidants that we heard about from Melissa Sundermann earlier, and improve overall dietary quality and related health outcomes. Next slide. And we see this illustrated in the blue zones, the 5 places around the world where people consistently live to over 100. And many individuals make it into their 90s without chronic disease. And among other important lifestyle behaviors, we see that those living in the blue zones, their diet is almost 95% plant-based with a large amount of local minimally processed foods. Next slide. This is a great handout that you can share with your patients. That's also important to remember when we're guiding older adults, or actually any of your patients, that meeting higher protein requirements, that plant foods such as beans, legumes, nuts, whole grains can provide a very valuable source of protein, as well as fiber and other nutrients that aren't found in animal products. Next slide. And eating minimally processed whole plant foods, such as your beans, legumes, lentils, nuts, whole grains, provide that protein that comes packaged along with fiber, antioxidants, phytochemicals, vitamins, minerals, without the saturated fat and cholesterol that accompany animal foods, as well as the added sugar and sodium that could come in highly processed foods. So eating more minimally processed plant foods lowers the risk of chronic diseases such as diabetes, heart disease, cancer, and promotes overall health. Next slide. One common concern in older adults is the cost of plant foods. And this is important because older adults are oftentimes on a limited budget. And this study findings suggest that eating a vegan diet can actually reduce a grocery bill by 16%, which is a savings of more than $500 a year. And also because a healthy plant-based diet promotes disease prevention, health restoration, and reduces risk of common chronic conditions, heart disease, diabetes, obesity. This could also lead to lower medical bills and prescription costs. So it could be an important cost-saving means for older adults as well. And the next slide just shows that a whole food plant-based menu can be more affordable and more nutritious, more nutrient dense. And this can be achieved by just a few simple swaps. Next slide. We've heard about some of the important nutrient considerations for the general U.S. population, and these apply to older adults as well. Nutrients of public concern: calcium, vitamin D, potassium, and dietary fiber. A lot of these can be addressed by improving your dietary pattern by adding more plants. And as we heard about from John, B12 is a nutrient of concern for many older adults as well. And this is due to changes in absorption that decrease with age, less intrinsic factor, atrophic gastritis, as well as polypharmacy and the interference with some medications, which can decrease absorption. So older adults, especially those that are eating a plant-predominant diet, will likely require a dietary vitamin B12 deficiency. So just to wrap it up here with older adults, the goal for nutrition health, next slide please, in older adults, or actually adult at any age, should be to preserve physical and mental well-being and maintain that high quality of life across the continuum of the aging process. With older adults, calorie requirements frequently decline, and there's change in nutrient digestion and absorption, metabolism, as well as what we highlighted here, these changes in protein physiology and metabolism, which require special consideration in older adults. So the selection of more nutritious foods to meet nutrient needs is therefore required with age, and this includes maybe a higher protein intake of about 1.2 to 1 grams per day, possibly 1.5 to even 2 grams per kilogram per day, which should be optimized with an even distribution of high quality protein-rich foods, approximately 30 grams per meal with adequate calories. And next slide, please. So plant sources of protein, key takeaways. Plant sources of protein provide additional nutrients that are important for health, disease risk reduction, management, reversal, promotion of longevity, as well as when we include regular physical activity. Most importantly, strength training or progressive resistance training. This is important to maintain muscle mass, strength, function, and to reduce sarcopenia and sarcopenic obesity. Most importantly, with older adults, is that early identification and intervention by an interprofessional healthcare team. And this is what's key to prevent functional declines, prevent sarcopenia, and ensure overall high quality of aging and quality of life. On this next slide, some of the references that from my section here. And then if you have any questions, I think maybe, Gia, we have about 30 seconds for questions.